Hello friends, it's Dr. Foroughi. Today we're going to talk about H.pylori. As always, if you enjoy this information, don't forget to follow us on Instagram and subscribe to our YouTube channel at Carmel Medical. H.pylori is a bacteria that can cause various GI problems. It's one of the few bacteria that can possibly cause cancer because it's very rare for infectious diseases to cause cancer. But H. pylori is one of those few infectious diseases that can further cause cancer. But on today's video, we're going to talk about the three most common problems that is caused by H. pylori. Now, let me tell you first how you can get H. pylori. H. pylori comes from contaminated food and possibly water, especially if someone from North America travels the Caribbean or goes on vacation in Middle East. They can easily get H. pylori from their water source or some water, like people washing their vegetables with those water source and stuff like that. You can get H. pylori through like the third world countries. However, H. pylori gets only treated if the patient or if the individual has signs and symptoms associated with H. pylori. We never treat silent H. pylori. So you can have it, but if you have no problems with it, it can live with you and you won't have any issues. But if you start having any signs and symptoms that I'll talk about it later on, then you should definitely get treated for H. pylori. Number one problem, which is common, and 100% of it is caused by H. pylori, is duodenal ulcers. Duodenum is a part of small intestine. So an ulcer in our small intestine can 100% be caused by H. pylori. Therefore, treating H. pylori in these kind of people can cure the problem 100%. How do these people present? These people get a severe mid-abdominal discomfort when they get hungry. And as soon as they eat food, their pain subsides and they feel so much better. So they keep eating food because the food is cure to their pain. So eventually, they gain a lot of weight. The second disease is gastric ulcers. About 50 to 60% of gastric ulcers are caused by H. pylori. These people present opposite to duodenal ulcer people. They get the pain and discomfort as soon as they eat, because when they eat, their stomach secretes acid, and that acid irritates the ulcer and they get pain and discomfort. So these group of people, they start eating less and less and less, and eventually they lose a lot of weight. But let me tell you something. Losing weight in medicine significantly is worse than gaining weight significantly. Both of them are really bad, but losing weight is worse. And gastric ulcer, if it does not get treated in the right way, and if the patient does not take it serious, it can cause further problem, and it can cause a cancer named maltoma if it gets not treated perfectly and patient ignores it. The third type of problem is the gastric esophageal reflux disease. I'm not saying that H. pylori is the cause of gastric esophageal reflux disease, but it can cause persistent signs and symptoms of gastric esophageal reflux disease. So for example, if a patient has been listening to their doctors and they have been watching their diet, they don't eat food late, they don't eat a lot of tomatoes, they don't eat a lot of chocolate or caffeinated beverages, they exercise, they have lost the weight that their doctor recommended to them, but they still have signs and symptoms of gastric esophageal reflux disease, then they get tested for H. pylori, and maybe treating the H. pylori can help them with the signs and symptoms of gastric esophageal reflux disease. There are various ways that the doctors can check to see if an individual has H. pylori infection. The most accurate way or the best way is for the doctor to do endoscopy in that individual. Basically, they put a camera through your mouth and they take a look at your esophagus, stomach, and the small intestine, and they take a sample through biopsy and they test it for H. pylori. But this is an invasive way, and doctors don't usually initially start doing that on every individual. They can also check your stool to see if you have H. pylori infection, or there's a special breath test that they can do to see if an individual is infected by H. pylori. If you have the signs and symptoms, and if you test positive for the H. pylori, then now it's time to get treated, to get rid of that bad bacteria. The treatment is for 5 days, and we usually use 2 antibiotics and a proton pump inhibitor because we want to reduce the amount of acidity in your stomach. Proton pump inhibitors, as I'm sure all of you heard about it, an example of them is omeprazole, which is an over-the-counter medication. Another name for it is Nexium, is used for the treatment of gastric esophageal reflux disease. And it's a treatment for H. pylori as well, and combined with 2 other antibiotics. The antibiotics that we commonly use are amoxicillin and clindamycin, but there are other antibiotics depending if the patient has allergy to these 2 or if the patient is not responding to these 2 medications. Usually, individuals, they start taking this antibiotic intensely for 5 days. 99% of people get better and they get cured. However, if you have duodenal ulcer, you get treated with H. pylori, your sinus symptoms goes away, congratulations, you're free, you don't have the H. pylori infection anymore, and you're good to go. If you have gastric esophageal reflux disease and you treat the H. pylori and their sinus symptoms gets better, congratulations, you got better. Just monitor your lifestyle, do the good lifestyle that you were following, and your reflux disease should be gone as well. However, if you have gastric ulcers and you were tested positive for H. pylori, we treat the H. pylori. Now it's turn for the doctor to do endoscopy on these individuals to make sure that the H. pylori has been cleared out 100%, because we don't want to take any risk on these people and we want to make sure that the H. pylori is cleared up to make sure that it's not there to cause any further problem or the cancer. If you have any question regarding H. pylori or any other topics that you would like us to talk about it, please let us know, and have a wonderful day and stay healthy.